Good morning, everybody. Today we are going to discuss anatomy of heart, part third. In this session, we will describe interior of the ventricles and their valves. Learning objectives for my today's class are: at the end of this session, students should be able to describe heart under following headings. They should be able to enumerate chambers of heart. They should be able to describe exterior and interior of right and left ventricle. They should also be able to describe valves of heart. Descriptions of anatomical specimens at the end of this session will cover dissection part of this session. Heart is a four-chambered muscular pump located in the middle mediastinum. Right and left atria receive blood from systemic and pulmonary veins respectively. Venous blood passes from right and left atria into corresponding ventricles through tricuspid and mitral valve respectively. Right ventricle pumps deoxygenated blood into pulmonary circulation and left ventricle pumps oxygenated blood into systemic circulation. Right ventricle forms most of the sternocostal surface of the heart. It also contributes to inferior margin of the heart. It is separated from the left atrium by atrioventricular groove and from left ventricle by anterior and posterior interventricular sulcus. It receives blood from right atrium by tricuspid valve and pumps the same into pulmonary circulation. Topography of right ventricle. Right ventricle forms most of the anterior surface of heart and a portion of the diaphragmatic surface of heart. The right atrium is to the right of the right ventricle, and the right ventricle is located in front and to the left of the right atrioventricular sulcus. Interior of the right ventricle. To see the interior of the right ventricle, make a window into it by dissecting out the anterior wall of right ventricle. As shown in this diagram, interior of the right ventricle is U-shaped. It is divided into inflowing part which is rough and outflowing part which is smooth. So this arrow represents the inflowing part of the right ventricle which is rough due to the presence of trabeculae corneae, and the second arrow represents the outflowing part of the right ventricle which is smooth. The supraventricular crest is an internal muscular ridge of the right ventricle that separates outflow tract of the conus arteriosus, or also called infundibulum, from the rest of the ventricular cavity. It passes obliquely from the interventricular septum to the anterior wall of the right ventricle. This black dotted line represents the supraventricular crest. Below the supraventricular crest is the rough part of right ventricle, and above the supraventricular crest is smooth and outflowing part of the right ventricle. The rough part of the right ventricle presents trabeculae corneae, which are rounded or irregular muscular columns which project from whole of the inner surface of the ventricle with the exception of conus arteriosus. They are in the form of ridges which are attached along their entire length on one side and merely form prominent ridges. Ridges are fixed at their extremities but free in the middle. Then papillary muscles are continuous by their bases with the wall of the ventricle, while their apices give origin to the chordae tendineae, which pass to be attached to the segmentus of the tricuspid valve. As shown in this figure, ridges are fixed throughout. They are simply elevations. Bridges are fixed at their ends and free in the middle. An example of bridge is septomarginal trabeculae, which is attached on one side to the septum and on the other side to the base of the anterior papillary muscle. Then papillary muscles are conical shaped structures with an base and apex. Base is fixed with the ventricular wall, whereas to the apex are attached chordae tendineae as shown in this figure. So what are papillary muscles? Each papillary muscle is conical in shape. It has a base and an apex. Base is fixed with the ventricular wall. To the apex are attached chordae tendineae. On the other hand, chordae tendineae are attached to the free margin of cuspus. Each papillary muscle is conical in shape. It has a base and an apex. Base is fixed with the ventricular wall. The apex are attached chordae tendineae. On the other hand, chordae tendineae are attached to free margin of cuspus. As shown in this diagram, this anterior papillary muscle which is attached to anterior wall of the right ventricle. Its apex are attached chordae tendineae, which are fibrous bands stretching between the apex of the papillary muscle and free margin of cuspus, as shown in this diagram. How are papillary muscles named? Papillary muscles are named depending on the wall to which papillary muscles are attached. For example, anterior papillary muscle is attached to the anterior wall of the ventricle. Posterior papillary muscle is attached to posterior wall of the right ventricle. It is also called the inferior papillary muscle, and septal papillary muscle is attached to ventricular septum. What is moderated band? It is a muscular band frequently extends from the base of the anterior papillary muscle to the ventricular septum. It is well developed in quadrupeds like sheep, but not so developed in human beings. From its attachments, it may assist in preventing poor distension of this ventricle and so has been named the moderator band or septomarginal trabecula. Why is moderator band important? Since this moderator band spans from the septum to the base of anterior papillary muscle, it carries with it a right bundle branch of conducting system. This gives importance to the moderator band. What are the major anatomical differences between the two ventricles? The major differences between the features of the two ventricles that we can see on dissection table are wall thickness of right ventricle is less than that of the left ventricle. It is said that wall thickness of left ventricle is 6 times more than that of the right ventricle. This is because of the fact that right ventricle pumps blood into pulmonic circulation as compared to left ventricle which pumps blood into systemic circulation where pressure is 6 times more than that of the pulmonary circulation. Number 2, shape of two ventricles. Right ventricle is crescent shaped as compared to left ventricle which is circular in shape. Again, because of the pressure difference, interventricular septum bulges into the right ventricle due to greater pressure in the left ventricle, giving it a circular shape and crescent shape to right ventricle. Papillary muscles. There are 3 papillary muscles in the right ventricle. They are named anterior, posterior, and septal. In contrast, there are only 2 papillary muscles in the left ventricle, anterior and posterior, for 2 cusps of the mitral valve. The number of cusps. In right ventricle, there is tricuspid and pulmonary valves, whereas in the left ventricle, there are mitral and aortic valves. Tricuspid valve is between the right atrium and right ventricle. It is guarded by 3 cusps, whereas mitral valve is between the left atrium and left ventricle. It is guarded by bicuspid valve. What are silent features are papillary muscles. The anterior papillary muscle is largest, most constant, and arises from the anterior wall of the ventricle. The septal papillary muscle is the most inconsistent, being either small or absent with chorditendiny emerging directly from the septal wall of right ventricle. The posterior papillary muscle may consist of 1, 2, or 3 structures with some chorditendiny arising directly from the ventricular wall. Smooth part of the right ventricle. It is also called the outflowing part of the right ventricle or conus arteriosus. It is also called infundibulum. This area has smooth walls derived from bulbus cordis. It leads into the pulmonary trunk, which is guarded by 3 semilunar cusps or valves. These semilunar valves prevent regurgitation of the blood into the right ventricle during diastole, whereas the tricuspid valve prevents regurgitation of the blood into right atrium during systole. Cavity of right and left ventricle. As already said, cavity of the left ventricle is circular, whereas the cavity of the right ventricle is crescent shaped. This is because of the fact that the interventricular septum bulges inside the cavity of right ventricle. Papillary muscles of the two ventricles. As already said, in right ventricle there are 3 papillary muscles. They are named anterior, posterior, and septal. The apices of these papillary muscles are attached to the free margin of tricuspid valve by means of chorditendiny. In contrast, for mitral valve, there are only 2 papillary muscles, anterior and posterior, in the left ventricle. But these papillary muscles are well developed as compared to the papillary muscles of the right ventricle. As shown by these arrows, in right ventricle there is anterior papillary muscle, posterior papillary muscle, which is also called inferior papillary muscle, and septal papillary muscle. They are attached to the free margin of tricuspid valve. On the other hand, inside the left ventricle there is anterior papillary and posterior papillary muscle which are attached to the free margin of mitral valve. What are atrioventricular valves? If we dissect out the atria from ventricles, we can see the 4 valves. These valves are tricuspid valve between right atrium and right ventricle, pulmonic valve between right ventricle and pulmonary trunk, mitral valve between left atrium and left ventricle, and aortic valve between left ventricle and systemic circulation. If we keep the same specimen now in anatomical position, we see on the right side and posterior lies the tricuspid valve, on the left side and posteriorly lies mitral valve, most anterior is the pulmonic valve, and aortic valve lies between anteriorly placed pulmonic valve and posteriorly placed mitral and tricuspid valves. Between the aortic valve and posteriorly placed mitral and tricuspid valve, there is a triangular area in which lies the central fibrous body of the heart. What is the structure of atrioventricular valve complex? The right atrioventricular valve complex is made up of three valvulae flatus, as already described, anterior, septal, and posterior. Surrounding them is the fibrous ring called the annulus, the supporting chordae tendineae, which are attached to the free margin of the cusp on one side and to the apex of corresponding papillary muscle. Left atrioventricular valve is also called the mitral valve because of its shape. It has two leaflets, anterior and the posterior, in contrast to the three on the right side. It prevents the regurgitation of blood from left ventricle to left atrium during systole. Structure of the mitral valve. It has two leaflets, anterior and the posterior. Commissures are areas where anterior and the posterior leaflets meet chordae tendineae. The chordae tendineae are fan-shaped connective tissue structures that connect the leaflets to the papillary muscles in the heart. Mitral annulus. The mitral annulus is a ring that attaches to the mitral valve. It connects the tissue to the left atrium and ventricle. Similarly to the leaflet, the mitral annulus has both anterior and the posterior portions. Let us describe the structure of mitral valve. Mitral valve has two leaflets, anterior, which is attached to the anterior papillary muscle, and posterior, which is attached to the posterior papillary muscle by chordae tendineae. It is surrounded by fibrous ring. Why chordae tendineae and papillary muscles are attached to the cuspus? The function of these chordae tendineae and papillary muscles are: they prevent the cuspus from being everted into the right atrium. They keep the valves closed during the dramatic changes in the ventricular size that occurs during contraction. This helps prevent separation of cuspus during ventricular contraction. Tricuspid valve. The right atrioventricular orifice is closed during ventricular contraction by tricuspid valve, so named because it usually consists of three cuspes or leaflets. The base of each cusp is secured to the fibrous ring that surrounds the atrioventricular orifice. This fibrous ring helps to maintain the shape of the opening. The cusps are continuous with each other near their base at sites termed as commissures. The free margins of the cusps are attached to the chordae tendineae, which arise from the tips of papillary muscles. Interior of the right ventricle. Inner rough surface of the right ventricle contains ridges, bridges, and papillary muscles. Ridges are elevations. Bridges or elevations fixed on two sides and free in the middle. An example of bridge is moderator band. And papillary muscles are conical in shape with base fixed to ventricular wall and to the apex are attached chordae tendineae. Moderator band, as already described, a single specialized trabeculum, the septum marginal trabeculum is also called the moderator band, forms a bridge between the lower portion of the interventricular septum and the base of the anterior papillary muscle. The septomarginal trabecula carries a portion of the chordae conducting system, the right bundle of the atrioventricular bundle, to the anterior wall of the right ventricle. Pulmonary valve. It guards the pulmonary trunk. It consists of three semilunar cusps with free edge projecting upwards into the lumen of the pulmonary trunk. The free superior edge of each cusp has middle thick-knit portion, the nodule, and a thin lateral portion called linule. The cusps are named left, right, and anterior, relative to their fetal position before rotation of outflow tract from ventricle is complete. Each cusp forms a pocket-like sinus, a dilatation in the wall of the initial portion of the pulmonary trunk. After ventricular contraction, the regurgitation of blood fills these pulmonic sinuses and forces the cusps closed. This prevents blood from refilling the right ventricle. As shown in this figure, these pulmonic valves are semilunar in shape. In the center of each valve is a thick-knit part called nodule. From the nodule projects thin part towards the wall called linule. So it is the filling of these cusps during the diastole that prevents regurgitation of blood from pulmonary trunk into right ventricle during diastole. Summary of the structure of the right ventricle. As already said, interior of the right ventricle is U-shaped and has two parts. Outflowing part is called infundibulum. is also called conus arteriosus, and the rough inflowing part bears trabeculae coronae. There are three papillary muscles in the right ventricle and two papillary muscles in the left ventricle. The septum marginal trabecula of right ventricle, which extends from septal wall to the base of anterior papillary muscle of right ventricle, is also called the moderator band. Left ventricle receives blood from left atrium and pumps the same into aorta during systole. Mitral valve prevents regurgitation into the atrium during systole, and aortic valve prevents same into left ventricle during diastole. The wall of the left ventricle is thicker than that of the right ventricle. Shape of the left ventricle is circular in cross section. Like right ventricle, interior of the left ventricle is in the form of ridges, bridges, and papillary muscles. There are only two papillary muscles in the left ventricle, but they are larger than the papillary muscles of the right ventricle. There is no moderator band in the left ventricle. In the anatomical position, the left ventricle is somewhat posterior to the right ventricle. As shown in this diagram, the wall thickness of the left ventricle is more than that of the right ventricle. There are only two papillary muscles, anterior and the posterior. These papillary muscles are attached to the leaflets of pre-margin of mitral valve by means of chordae tendineae. Interventricular septum is thicker than that of the right ventricle. It bulges into right ventricle, making it crescent-shaped, in contrast to circular cavity of the left ventricle. It forms the anterior and part of the right wall of the left ventricle. What are the parts of interventricular septum? It has a muscular part which is thick and a membranous part which is thin. The muscular part is thick and forms the major part of the septum, whereas the membranous part is thin, upper part of the septum. A third part of the septum may be considered an atrioventricular part because disposition above the septal cusp of tricuspid valve. Aortic valve is also called the tricuspid valve. It is semilunar in shape. They are named as coronary and non-coronary. Coronary are those sinuses wherefrom coronary arteries arise. Non-coronary does not give origin to any coronary artery. From coronary valve arises right and left coronary arteries. So they are named as the left anterior coronary cusp from which left coronary arises, the right coronary cusp from which right coronary artery arises, and non-coronary cusp. Above the valve is a dilatation of the vessel called coronary sinus. Bicuspid valve is found in 1 to 2% of the population, where instead of 3 cusps, there are only 2 cusps in the aortic valve. The fibrous skeleton of the heart. The cardiac skeleton is the structure of dense connective tissue that separates the atria from ventricles. It is in the form of rings or annuli around the valves of heart. The function of this fibrous skeleton is that it electrically separates atria from ventricles. So fibrous skeleton of the heart consists of dense connective tissue that surrounds the mitral and tricuspid valves and extends to the origins of aorta and pulmonary trunk. The aortic valve occupies the central position with the other valve rings attached to it. The right fibrous trigone is formed by triangular junction between the aortic valve and medial parts of tricuspid and mitral valves, and it represents the largest thickening and strongest portion of the cardiac skeleton. Together with the membranous septum, the right fibrous trigone constitutes the central fibrous body. The membranous interventricular septum is an inferior extension of the central fibrous body that attaches to the muscular interventricular septum. The membranous septum is crossed on its right aspect by attachment of tricuspid valve, dividing the septum into atrioventricular and interventricular components. Let us make the understanding of fibrous skeleton of the heart very simple in this diagram. In this diagram, heart is placed in the normal anatomical position with tricuspid valve lying posteriorly and on the right side, and mitral valve lying posteriorly and to the left. Most anteriorly placed is pulmonic valve. Between the mitral and aortic valves posteriorly and anteriorly placed pulmonic valve lies the aortic valve. This valve is surrounded by a fibrous ring. As shown in this diagram, tricuspid valve lies posteriorly and to the right. most anteriorly placed is pulmonic valve. Mitral valve is placed posteriorly and to the left. In between the pulmonic valve anteriorly, mitral and tricuspid valve is placed posteriorly lies the aortic valve. Each valve is surrounded by this fibrous ring called annulus. As shown in this diagram, mitral valve is placed posteriorly and to the left. Tricuspid valve is placed posteriorly to the right. Pulmonic valve is most anteriorly placed. Between the pulmonic, mitral and tricuspid valve is aortic valve. So between the anteriorly placed aortic valve and posteriorly placed mitral and tricuspid valve is the green area. This represents the trigonum fibrosum sinistrum on the left side, trigonum fibrosum dextrum between the tricuspid, aortic and mitral valve on the right side. So what are the functions of fibrous skeleton of the heart? The fibrous skeleton of the heart, electrically inert central body and skeleton of the heart, functions to electrically isolate the atria from ventricles except at the site of penetration of AV conducting system. It gives attachment to the musculature of the heart and separates atrial musculature from ventricular musculature. It surrounds and supports base of each valvular ring. It supports and keeps patency of openings and thereby keeps patency of the valves, thus makes cusps competent. Now let us go to these wet specimens for identification of these anatomical structures. In this wet specimen, A represents posterior papillary muscle in the right ventricle, B represents mitral valve, posterior leaf, C represents pulmonic valve, and D represents anterior papillary muscle. In this wet specimen, A represents aortic valve, B represents septal papillary muscle, C represents anterior papillary muscle, and D represents quadi tendinity. In this section, in this transverse section of the ventricles, you can see that A represents crescent shaped right ventricle, B represents interventricular septum, and C represents circular cavity of left ventricle. In this specimen, A represents pulmonic valve, B represents tricuspid valve, C represents anterior papillary muscle of the right ventricle, and D represents posterior papillary muscle of the right ventricle, whereas the E represents septal papillary muscle of the right ventricle. In this specimen, A represents pulmonic valve, B represents septal papillary muscle of tricuspid valve, C represents anterior papillary muscle, and D represents posterior papillary muscle. E represents moderated band. This is a wet specimen where atria have been removed and we can see the four valves of the heart. This specimen is placed in normal anatomical position where A represents tricuspid valve which is placed posteriorly and on the right side. B represents the mitral valve which is placed posteriorly and to the left. C represents the aortic valve and D represents most anteriorly placed pulmonic valve. In this wet specimen, this line represents the free margin of the tricuspid valve. The second line represents quadi tendini and third line represents apex of papillary muscle. B represents the septomarginal trabeculae, C represents the anterior papillary muscle, and D represents tricuspid valve. Here A represents aortic valve, B represents pulmonic valve. Now in this specimen, you can see how to keep these valves in normal anatomical position. In this wet specimen, which is on the right side, you can see both atria have been removed. Cardiac valves have been kept in normal anatomical position. In this slide, on the right side, you can see four valves of the heart. After removal of atria and keeping this wet specimen in normal anatomical position. M represents the mitral valve, T represents the tricuspid valve, A is aortic valve, and now if we concentrate on this specimen, there is a triangular area between anteriorly placed aortic valve and posteriorly placed mitral and tricuspid valve. In this, the red dotted area represents the central fibrous body of heart. Now let us go for a quiz based on this lecture. You will be provided an MCQ with four options. You have to choose the most accurate one. Which of the following statements follows about tricuspid valve? A. It is also called AV valve. B. It is guarded by three cusps. C. The cusps are posterior, anterior and inferior. D. Cusps prevent regurgitation of blood into right atrium during systole. C is the wrong option. Which of the following is the strongest papillary muscle of right ventricle? Anterior, posterior, inferior, septal. A is the correct option. Which of the following is not a part of the tricuspid valve? A. Annulus, B. Septum original trabeculae. C. Papillary muscle. D. Cauda tendini. B is not part of tricuspid valve. Our next question is trabeculae coronae are seen in which chamber of the heart? Right atrium, left ventricle, right ventricle, both. B and C. D is the correct option. Which of the following is false about moderator band? A. It is also called the septum marginal trabeculae. B. Carries right bundle branch of conducting system. C. Connects base of anterior papillary muscle with interventricular septum. D. It is well developed in humans. It is poorly developed in humans. It is well developed in quadrupeds. Which of the following is true statement? Right ventricle is circular in shape. Left ventricle is crescent shaped. Left ventricle wall is thicker than right ventricular wall. There are three papillary muscles in left ventricle. C is the correct option. Left ventricular wall is thicker than the right ventricular wall. Which of the following is not a true statement about aortic valve? There are three aortic sinuses. It is guarded by three cusps. It has one coronary sinus. Coronary arteries originate from coronary sinus. C is the wrong option. Do not forget to like, subscribe and share this channel. Thank you for watching.